Here is your question. Oops. Oh, sorry. I have given you the yes. No, sorry. I gave you the wrong station.
Uh, Excuse me, ma'am.
Yes.
Uh, Sorry, I had to open the door. There is someone at the door, so can I just quickly go there
Yes.
and
Yes. Yes.
come
I've
back?
stopped the timer. Yes.
Thank you, ma'am. Thank you.
20 seconds. Read the question. Right. So if you've read and understood, considering it history taking station, kindly please begin. Please begin. You can begin. Oh, okay. Got disconnected. Continue.
Okay. So, good evening. My name is Dr. Daniel Raza, and I'm a surgical doctor. And can I please confirm your name and age, please?
So is he going to help you? I'm Lisa, 20 years old.
Okay, it's a pleasure to meet you. Today, I will be asking you questions regarding your illness. So, is that okay?
Yes.
All right. So, what has brought you here today?
Uh, I've got diarrhea. I've had 8 episodes so far, and I'm feeling my tummy pain all over my tummy, and it's really bad. I even
Mm-hmm.
poo blood, so I'm not feeling good.
All right. So, I'm really sorry to hear you feeling like this. So, let's work together to find some relief. So, can you please tell me exactly since when you have been having this abdominal pain or tummy pain?
You can say from last about 2 months, or yeah,
All right.
sometime.
So,
Yes,
can you please tell me exactly where the pain is? Can you
all
please
over
point
my
out to that
tummy.
side?
It's all over my tummy.
Okay, I'm so sorry to hear that. So, how did it start? Did it start suddenly or gradually?
It just comes and goes.
All right. So, has it changed recently over the time period?
Uh, what you mean, pain? Yes,
Yes, pain.
when it comes, it becomes really bad, and when it goes, it just goes away.
All right. So, how would you describe this pain? Is it very sharp? Is it burning? Is it cramping?
Yeah, it's kind of cramping, you can say so.
All right. So, does it stay in the tummy or does it move anywhere else?
All over my tummy. It just goes all
All
over
right.
my tummy. Yeah.
Okay. So, what makes it better and what makes it worse?
I don't know. When I go to the loo and I do poo, it becomes better. But now, from last 6 weeks, it has become really bad because of like I have blood mixed with my poo as well. So that's like really worrying me a lot.
Yes, it must be very disturbing for you. So, if we talk about on a scale of 1 to 10, considering 10 is the highest number, so how would you rate this pain?
Well, you can say around 8.
All right. So, talking about the loose stools, so how many loose stools do you experience per day?
Today, this time I've had 8 episodes so far and loose watery diarrhea.
All
So
right. So is it completely watery every time?
yeah, now it has become like that.
All right. So you have mentioned that you are experiencing blood in your loose stool. So can you please tell me how much blood do you see in your stools?
You can say approximately a big spoonful.
All right. So do you feel tummy pain that do you feel that your tummy pain worsens with opening your bowel?
No, I'll rather say it becomes better.
All right. So have you ever experienced any slime discharge or any jelly-like discharge in your stools?
I don't know. I haven't paid much attention.
All right. So have you experienced any painful red eye or any mouth ulcers?
No, 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 not that. No,
All right. On any skin lesions or any skin problems?
no, not at all.
All right. So any joint pain or backache?
No, no, I'm fine
All
other.
right. All right. So have you noticed that do you have any change in your bowel habits over some time period over the past few months?
Yeah, it has become so like that. Yeah,
All
from
right. So
last.
have you ever noticed?
Yes,
Okay. So have you ever noticed that your clothes become loose over time, or do you
yes.
have you noticed it does?
Everyone is complaining. They are saying, "What have you done? You've lost so much weight. My clothes are hanging literally on me."
All right. So have you noticed how much weight have you lost?
I don't know, approximately 10 pounds, you could say, in the
All
last year,
right. So
approximately. Yeah.
okay. So and how has your appetite been?
That's okay. That's absolutely fine.
All right. So do you have any long-standing history of constipation?
Sometimes, yes, when I have too much stress from my school, it becomes like this, but otherwise, yeah, it wasn't that bad.
Okay. And do you notice that this tummy pain worsens with the social stress?
Yeah, I haven't noticed this, but yeah, you could say so.
All right. Thank you. So do you see your GP for any other medical conditions?
No, not at all. I'm fine otherwise.
All right. So have you ever been hospitalized before?
No, never.
And have you ever had any surgery done?
No, never before.
Oh, all right. So do you take any medications regularly?
No, no medications.
All
Okay,
right.
can
So
you
do you,
summarize your history taking now?
all right. So I have taken history of a 20 years old woman. She has no known prior comorbids, and she presented to us with a complaint of central abdominal pain, and that was associated with loose stools. The pain is around, she is experiencing since the last 2 weeks, and the pain is delicate in character associated with multiple loose stools, that is specifically 8 episodes per day, and it is associated with the blood, and that is around 1 tablespoons in quantity. And she
Okay.
also having a significant weight loss of around 10 pounds in the few past months. And
So what are your
currently,
provisional and differential diagnosis for her?
yes, my provisional diagnosis is IBS, and differential diagnosis includes IBD,
Okay.
or could be gastroenteritis,
Okay.
or
How do you
and
plan to manage this patient?
yes, for the management, I would like to conduct a general physical examination, abdominal examination, including DRE, and I would do some blood testings that includes CBC, urea creatinine electrolytes, LFTs, and calcium, magnesium, and phosphorus. And as she is having long-standing history of diarrhea, so I would also consider albumin for the nutritional status as well.
Okay.
And I would do the
But
stool analysis. Yeah.
yes, that has been done and shows negative. Okay. What treatment would you suggest for her?
Yes, for the pain, we can offer her antispasmodics.
Yes, and
And for the diarrhea, we can put her on ORS, that is oral rehydration
yes,
solutions.
yes.
to prevent her from any dehydration.
Yes.
And for based on her hemoglobin levels, we can offer her the iron supplementations to build up for the hemoglobin.
Okay, good. If time would have allowed you, now Belle has gone. If time would have allowed you, how would you have completed your history?
Yes, I would have asked her the family history, the personal history, and the ICE questions that
Yes.
I wanted to ask her what is the probable cause of the illness and what she is hoping us to do for the illness and what she is expecting us to do for the illness and what she is most concerned about.
What else? Two more things,
Mm.
tell me. She's 20 years old woman or girl. So one, you will ask about her menstrual history. Second,
Yes.
if she is sexually active or not.
All right.
Could be ectopics, could be anything. So these are
Oh,
the differentials you can keep in your mind. And like in order to rule that out, you have to ask these two questions as well. Good. And one, my last suggestion, it was good. When you are mentioning the diagnosis, I would request that you mention the complete name: IBS, inflammatory bowel disease,
okay.
inflammatory bowel, yes, and irritable bowel syndrome, like complete name instead of like
Okay.
just the
Okay.
abbreviations. Good. Thank you.
Yes.